Let's start out with running. How many of the injuries, how often do people come in and the first thing you find out about them is they're runners?
You can be a runner from different reasons. You can be coming in because you run for sport, or you just run because that's your favorite activity. So a lot of runners come into me on a regular basis with different issues of different types, and I just do my best to help them get back on the road.
How many of the injuries, I mean, on a basic scale, let's say percentage-wise, are runners?
Runners could represent anywhere between 30 and 40% of my average caseload on any given time, especially in the orthopedic setting.
Is it fair to say that most of the injuries then you get from runners have got to be knee pain?
Not necessarily. You can have anything from low back pain. You can even develop neck pain if you're not running correctly. It just varies tremendously, and that's why you need to have a complete evaluation in order to determine why your body is hurting, if it's hurting because of running.
Yeah, I think that's fair. We're going to talk about that later, which is form, as in any sort of exercise that you do. Before we leave the knee behind, though, what exactly is, if you look at it from a biomechanics standpoint and a health standpoint, what is runner's knee?
Runner's knee is a kind of a catch-all term that represents knee pain in a couple different aspects. But the two diagnoses that normally come along with runner's knee is something called patellofemoral pain syndrome, which is basically pain around your patella. And that's typically towards the front of your leg. And another one that you may develop is something called IT band syndrome. That's typically pain along that lateral aspect of your knee. But they could all present with different symptoms, and that's why it's really important to have a complete evaluation.